Who the hell let the rookie nurse touch him? The hospital director barked from the camera room, slamming his fist on the desk. Ava stood there in light blue scrubs, gloves still stained, breathing hard. On the bed was a plain-looking man in a grey hoodie. No uniform, no family, no ID, just another civilian dumped at the ER doors. Except when Ava leaned in to check his pulse, she saw it. A small Grim Reaper tattoo tucked behind his neck, half hidden under the collar. And the second her fingers pressed to his skin, the man's eyes snapped open, sharp, trained, like he woke up from war. The director shoved past the nurses and pointed straight at her. You stupid batch. You don't touch a patient like that without clearance. Ava didn't argue because she'd felt it. That pulse wasn't civilian. That tattoo wasn't decoration. And the medical tag stitched inside his sleeve had a code she hadn't seen since deployment. The director ripped her badge right off her chest. You're fired. Get out. Ava turned to leave. And that's when every phone in the ER went dead at once. Then the red emergency line rang and the receptionist answered only to go pale and whisper, "The Pentagon is on the phone." Before we begin, if you enjoy intense medical military stories like this, take 2 seconds to comment where you're watching from and hit subscribe. It genuinely helps these stories reach more people. Now, let me take you to a civilian hospital on a night that was about to turn into a Pentagon problem. It was 11:47 p.m. when the ambulance doors slammed open and 2 paramedics rolled in a man who looked normal. No uniform, no rank, no obvious VIP energy. Just a dark hoodie, worn boots, and the kind of stillness that made the hallway feel colder. He wasn't bleeding everywhere. He wasn't screaming, but his skin was too pale, his breathing too shallow, and his eyes, when they fluttered, didn't look confused. They looked trained. The charge nurse barked orders. Residents rushed in like they were chasing a resume moment, and someone muttered, "Probably another overdose." Ava stood near the wall with her light blue scrubs and her blonde hair tied back, watching quietly the way rookies do when they're told not to get in the way. But something in her chest tightened because she'd seen men like this before. Men who came in silent because they were taught to. The attending physician started firing off instructions without even looking at the patient's neck. His hands already reaching for sedation. His combative risk. We don't need him waking up in the middle of an airway. A resident nodded too fast, eager to agree. But when Ava stepped closer to adjust the monitor leads, she caught it half hidden under the hoodie collar. A small tattoo behind his left ear. A Grim Reaper inked clean and sharp like it had been done by someone who didn't care about art. Only meaning. It wasn't the kind of tattoo you got on spring break. And right under it, barely visible, were 2 tiny dots, old puncture scars. The kind left by Field 4s, military 4s. Ava's fingers paused for half a second. Not fear, recognition. The kind you swallow quickly so nobody notices. The doctor waved her off like a fly. "Nurse, don't touch him. We don't know who he is." Ava didn't argue. She never did. She just watched the monitor. Heart rate climbing, oxygen dropping. The patient's jaw clenched like he was fighting something inside his own lungs. The resident pushed the sedative anyway, and the moment it hit the 4, the man's breathing stuttered, one ugly pause, then a violent cough. His body arched against the gurney straps. The monitor screamed. A wrong call? A bad interaction. A chain reaction that could kill him in less than a minute. The doctor cursed and reached for the crash cart. Everyone started talking at once. And in the middle of that noise, Ava moved like she didn't need permission. She stepped in, switched the line, elevated his head, and calmly told respiratory, "Bag him now. Don't wait." Her voice wasn't loud. It was exact. And for a split second, the whole trauma bay obeyed her. The man's eyes snapped open, not wide, not panicked, sharp. He looked straight at Ava like he was trying to place her in his head while fighting for oxygen. His gaze dropped to her hands, steady, practiced, then to her face, and something in his expression shifted. Not gratitude, not fear, something colder, like he just realized he was in the wrong place with the wrong people at the wrong time. The doctor didn't notice any of that. He was too busy saving his own pride. "Who authorized you to touch him?" he snapped. Ava kept working, not meeting his eyes. She wasn't trying to be a hero. She was trying to keep a human being alive. But the doctor saw it as disrespect. "This is a civilian hospital," he hissed. "You don't freelance in my trauma bay." Then the hospital director arrived because someone always calls the director when a situation smells like liability. He was a sharp man in a suit who wore authority like cologne. He didn't ask what happened. He didn't ask what Ava saw. He walked in, took one look at the patient, and his face hardened like he already knew this case was going to ruin someone's night. His eyes landed on Ava. "You," he said, pointing like she was a stain. "Get away from him." Ava stepped back instantly, not because she was scared of him, because she was trained to de-escalate. Oh, but the director wanted blood. The social kind, the humiliating kind. "Do you have any idea what you just did, you stupid little girl?" He snapped loud enough for every nurse, every resident, every security guard to hear. "You touched a restricted patient without clearance. You're not a doctor. You're barely a nurse. You're fired." Ava's face didn't change. That's what made it worse. The director hated that she didn't cry. He hated that she didn't beg. He leaned in closer and said it nastier, like he needed to feel powerful. "Get your hands off my staff badge and get the hell out of my hospital." You dumb. The room went silent in that special way. Hospitals go silent when everyone hears something they know they'll remember forever. Ava swallowed once. Her eyes flicked back to the man on the gurney. He was stable now, still pale, was still quiet, but awake, watching, and when the director turned away, the man's fingers moved barely. He reached toward his hoodie collar as if checking the Grim Reaper tattoo himself, then looked back at Ava like he wanted to speak, but chose not to. Ava walked out the trauma bay with her shoulders straight, holding her badge in her palm like it weighed 100 pounds. She didn't make a scene. She didn't tell anyone what she'd noticed. She didn't even defend herself. But as she reached the main hallway, the building's lights flickered just once, like the hospital took a nervous breath. The wind outside slammed into the windows hard enough to rattle the glass. And then the red emergency phone at the front desk rang, not the normal line, the one nobody used unless it was federal. The receptionist answered, "Listen for 2 seconds." And her face drained completely. She covered the receiver with her hand and whispered one sentence that made every person in the lobby freeze. "They're saying it's the Pentagon and they want the nurse you just fired." The receptionist didn't even hang up properly. She just stared at the director like she'd seen a ghost, her hand still clamped over the receiver. "Sir," she whispered, voice shaking. "They said, it's the Pentagon." The director scoffed like that was impossible, like the word itself was a prank. "The Pentagon doesn't call civilian hospitals," he snapped. But then the receptionist added, "They asked for the rookie nurse by name." And that tiny detail by name hit the room harder than a scream because Ava hadn't told anyone her full name tonight. Not the director, not the doctor, not the charge nurse. Yet, someone on the other end of that line said it like it was already printed on a file. The director's face twitched. He grabbed the phone out of the receptionist's hand like he was ripping control back into his own world. "Who is this?" he demanded into the receiver, loud and arrogant. He listened. His jaw tightened. He glanced through the glass toward the trauma bay. Then his voice dropped. "Yes. Yes, sir." The director turned away from everyone, but the whole lobby could still hear him swallowing his pride in real time. "No, she's not on shift anymore." A pause. A longer pause. And then the director went pale. Not embarrassed pale. Scared pale. The kind of pale you get when you realize you just kicked the wrong door in the wrong neighborhood. He slowly lowered the phone like it weighed 50 pounds. "Find her," he said to security, voice suddenly thin. "Now." Ava was already halfway down the service corridor, the one staff used when they didn't want to be seen. Her badge sat cold in her pocket. Her hands were still clean, but she could feel the director's words stuck to her skin like grime. She pushed through the exit door into the loading area where the night air smelled like wet concrete and diesel. She didn't cry. She didn't even look back. That was AA's thing. Quiet exits. The kind that didn't give people the satisfaction of watching you break. But she didn't make it far. A black SUV rolled into the loading bay like it owned the asphalt. No sirens, no flashing lights, just presence. It stopped. The engine stayed on. And a man stepped out wearing plain clothes that were too neat for a hospital and too calm for a civilian. He looked at Ava once, then lifted his hand in a gesture that wasn't a wave. It was a signal. Ava froze. Inside, the civilian patient sat up on the gurney like the straps weren't even there. The attending doctor tried to stop him, but the man's eyes cut toward him, and the doctor instantly backed off like he'd been corrected by a superior officer. The man slowly pulled his hoodie down from his neck, exposing the Grim Reaper tattoo fully. Now, under the Reaper's scythe was a tiny set of numbers, so small most people would never notice. A resident leaned in, squinting. "Is that a unit number?" he murmured. The man didn't answer. He simply reached into the inside pocket of his hoodie and pulled out a folded ID card. It wasn't a driver's license. It wasn't military issued in the way people expected. It was something else. The kind of credential that didn't ask permission. He handed it to the director without a word. The director looked at it for half a second and his knees almost buckled. The director forced himself to breathe. He handed the ID back with shaking fingers, trying to smile like he hadn't just been humbled. "Sir, we had no idea," he stammered. "Our nurse acted outside protocol. I handled it." The man finally spoke, voice rough like he hadn't used it much lately. "You handled it," he repeated like he was tasting the words by firing her. The director tried to recover. "We have procedures." The man cut him off without raising his voice. "Your procedure almost killed me." That line shut the room down because everyone knew it was true. The sedative, the delayed airway, the panic. Ava had been the only one who moved like time mattered. And the man turned his head slightly toward the trauma bay door. "Where is she?" he asked. Security found Ava at the loading dock, but they didn't get to grab her. The man from the SUV stepped between them with a calm smile that had no warmth. "She's with us," he said. The guard hesitated. "Sir, this is hospital property." The man didn't even look at him. He just said, "Try to stop her." The guard didn't move again. Ava stood there, shoulders squared, looking at the SUV like she was trying to decide whether this was real or another humiliation. The man nodded toward her politely. "Miss Ava Harper?" he asked. Ava's eyes narrowed. Hearing her last name out loud, "Here now," made something cold move under her ribs. "Who are you?" she asked. The man answered like it was normal. "Pentagon liaison. You were supposed to be on a different rotation. We had a schedule." Ava blinked once. "I'm a nurse," she said flatly. The liaison smiled. "Tonight, you're whatever keeps him alive." Back inside, the attending doctor finally found his courage. "This is insane," he snapped. "You can't just take staff off hospital grounds." The Grim Reaper man turned his head slowly toward him. "I'm not taking her," he said. "I'm returning what you threw away." Then he swung his legs off the gurney, stood up, wincing only slightly, and walked past the doctor like the doctor didn't exist. The whole trauma bay watched him cross the floor with the kind of control you don't learn in med school. He stepped into the hallway and for the first time the staff saw what Ava had seen earlier. The posture, the eyes, the calm that doesn't come from safety. When he reached the loading dock door, he paused. He looked at Ava and then in front of everyone, he did something that made the air change. He gave her a small precise nod. Not a thank you nod, a recognition nod, like he knew exactly what she was. Ava didn't nod back. She just stared at him, expression unreadable. The director pushed through the door behind them, still trying to regain control. "This is a misunderstanding," he said quickly. "We can reinstate her. We can fix this." The liaison laughed once, quiet, sharp. "You can't reinstate her," he said. "You never had her." The director frowned. "What does that mean?" The liaison's smile faded. "It means she wasn't hired the way you think." Ava's fingers curled slightly at her side. The Grim Reaper man looked toward the stormy night sky, then back at Ava. "You didn't tell them," he said almost amused. Ava answered softly. "They didn't ask." The director's voice cracked. "What is she?" he demanded louder now, desperate. The Grim Reaper man stepped closer until he was within a foot of Ava. He lowered his voice, but it carried anyway. "She's the reason I'm alive," he said. Then he looked at the director like he was looking at something small. "And if you'd kept your mouth shut tonight, you could have gone your whole life without learning that." The director swallowed. "I won her file," he said weakly. The liaison's eyes hardened. "There is no file. You're cleared to read." And right then, the storm outside roared again. The lights in the loading bay flickering like the building itself was nervous. Ava finally spoke, voice quiet, almost bored. "Why am I being pulled?" she asked. The Grim Reaper man held her gaze. "Because someone tried to kill me," he said. "And they're still inside this hospital." Ava didn't react outwardly, but her eyes shifted just slightly toward the main doors, toward the staff, toward the trauma bay, toward the director. And in that moment, the liaison noticed something and stiffened. He looked down at Ava's wrist as her sleeve moved. There, half hidden under her scrubs, was a faint scar pattern that wasn't from nursing. It was from restraints, from field extractions, from war. The Grim Reaper man's voice dropped even lower. "Tell me the truth," he said. Are you just a nurse, or are you the reason they buried SEAL Team 9? Ava didn't answer him right away. She didn't because she couldn't. Not without stepping back into a version of herself she'd spent years burying under scrubs and routine. Instead, she looked past the Grim Reaper tattoo, past the black SUV, and past the liaison's polite threat, and back through the loading dock door. The hospital was still running like nothing had happened. People still moving, phones still ringing, a normal night. And that was the sick part. Because if someone had tried to kill a Tier 1 asset inside a civilian hospital, then this place wasn't a hospital anymore. It was a stage. Ava's voice finally came out low. If he's still inside, she said, then we don't leave. The liaison blinked like he hadn't expected that answer. The injured man's mouth twitched. That's what I was afraid you'd say, he murmured. They moved fast. Not like action heroes, like professionals who'd done this too many times. The liaison slipped inside first, showing nothing in his hands, but walking with that invisible authority that makes people step aside. The Tier 1 man followed, hood up again, posture still controlled, even with pain grinding behind his ribs. Ava stayed a half step behind them, scanning faces, nurses, residents, security. No one looked suspicious, which meant the person they were hunting knew how to blend. And Ava knew that trick. She'd lived off it. They reached the trauma bay hallway and the liaison leaned in close. You said someone tried to poison him, he whispered. Ava shook her head once. No, she said. Someone tried to sedate him long enough to stop his breathing. That's different. The Tier 1 man's eyes sharpened. So, it wasn't panic, he muttered. It was timing. Ava didn't respond because she'd just noticed something that made her stomach tighten. Someone had replaced the crash cart seal. It was a fresh seal. Too fresh. The director appeared at the end of the hallway and trying to keep up. He was sweating now, face shiny under fluorescent light. This is insane, he hissed. We have patience. We have liability. The liaison didn't even look at him. You have a security breach, he said flatly. The director scoffed, but it came out weak. By who? Ava answered without turning. A staff member, she said. Or someone wearing staff clothing. That line made the director freeze because it wasn't dramatic. It was true. In war, you look for weapons. In hospitals, you look for badges. Ava stepped toward the medication room and saw the lock was still open. It should have been closed. She pushed the door with her shoulder. Inside, everything looked normal. Shelves, vials, labels. But the trash bin had been changed. A clean liner. And there was one thing inside it that didn't belong. An empty syringe wrapper with no hospital barcode. Ava picked it up with gloved fingers and held it under the light. The liaison's face changed. That's federal issue, he whispered. That's not from here. The Tier 1 man exhaled once through his nose. They're still in the building, he said. Ava didn't panic. She never did. She walked out, shut the medication room door, and looked down the hall. Lock down the exits, she said. The director snapped. You can't order my staff. Ava finally turned and met his eyes, and the director flinched because there was something behind her calm that didn't belong in a hospital. Ava didn't raise her voice. She didn't threaten. She simply said, if you don't lock the exits, more people die. The liaison stepped in smoothly. Pulling out a phone and showing the director something on the screen. Some kind of credential, some kind of authority. The director's mouth opened, then closed. He swallowed hard and nodded like a puppet. Ava watched him go, then looked at the Tier 1 man. You need to sit, she said. He shook his head. Not until I know who's inside, he replied. Ava's gaze slid to his neck tattoo. Subscribe to our channel to watch such videos.